Wintringham is an organisation that looks after the elderly homeless, so we're a specialist organisation. My role here is to manage all the services.
One of the things that we do at Wintringham is we try and give every position as much responsibility and make their jobs as broad as possible, because we feel that's one of the things that that makes work satisfying, having plenty of variety and taking on responsibility.
As part of our work with the Workforce Development Fund, we sought out RTOs who were prepared to work with us. Now, I've explained that we're a specialist organisation working with the elderly homeless, which means that a general training doesn't really cover the needs that we have for our workers. So we were very interested in partnering with someone who would adapt the course to meet our specialist requirements. One important factor of our course delivery was the RTOs. All of them were willing to do that training at our sites, which meant the staff were much more comfortable in the environment they were learning in, they didn't have to travel. All of those types of things were really, really helpful.
The way that we operate within Victoria University is to achieve and then maintain very open channels of communication. We discuss at length the organisation's requirements, and then we develop and design a program that will meet their specific needs.
I liked the learning. It was, genuinely interesting and stimulating. I enjoyed the interaction with my colleagues and coming to understand them better too. The thing that I like the most is listening to their stories, and I never tire of hearing about their experiences and reflecting on the richness of life.
With Wintringham specifically, we found that working with an experiential learning theory worked best, because these staff members that come to us have a huge amount of experience. They're not fresh nurses learning from scratch. We're scaffolding, we're building their learning from an already solid foundation.
So I was fortunate enough to complete 2 training modules, my medication endorsement and then my diploma of nursing. Prior to my injection module, I would need to rely on palliative care nurses to come into the hostel and administer those injections to residents if they were in pain, so it was a lot longer for the resident to wait for pain relief, whereas now I can do that. I feel really proud to work for Wintringham.
Wintringham actually obtained the funding initially, and then it became essential that we all work together, including the Industry Skills Council, to meet the funding requirements. It's been a process of ongoing and continual communication.
We found the process to access the fund very simple to use, and that we had a lot of support to do it.
We often needed a little bit of support and assistance to make sure that all the correct paperwork was provided. So CSH, ISC were terrific with that. We were able to call them, they were able to give us good advice and able to make sure that we met all of the requirements to in turn assist the RTOs to be eligible for the funding that they would be paid.
So it's about really getting involved with your partner, with the organisation, and ascertaining what their direct and specific workforce development needs are.
Wintringham is a very good example of a National Workforce Development Fund project. They were very careful in their choice of registered training organisation, and as a result of that, they've managed to deliver real business results across all of the areas where they had training under this program.
It enabled us to do training which extended the skills and base of our staff incredibly, but we could not have afforded to do it without the fund.